Are you thinking about getting a septorhinoplasty, but you're not sure about the recovery and what to expect? I'm Dr. Dominic Castellano, Elite Facial Plastic Surgery, and today I'm going to talk to you about the recovery process. So before we jump into the recovery of the septorhinoplasty, let's talk about what is a septorhinoplasty. As the name states, it's the septo part is your septum. The septum is a midline structure that basically runs from the front of the nose all the way back, and it essentially divides the nose into a right and a left side, much like a wall in a room divides a room into two sides. That septum is made up of cartilage and bone, and that is normally what is straightened to help improve your ability to breathe through your nose. Most surgeons will also normally address what are called the turbinates at the same time to also facilitate making as much room possible to help improve airflow through the nasal cavity. Now, the second part of the procedure, called a rhinoplasty, is where you're essentially changing the appearance of the nose. And changing the appearance of the nose typically involves not only addressing the bone part up here, but also the cartilage part involving the lower part of the nose to reshape things to achieve the desired result you're looking for. What is septorhinoplasty recovery like? The first day of your surgery, you're going to go home and you're normally going to have a splint on your nose. That first day is typically when you're going to have significant swelling, and you'll be coming out of the anesthesia and you'll be certainly quite sore. The next day, post-op day 1, normally the swelling should be settling out. And from post-op day 1 to post-op day 7, you should be following your surgeon's recommendations and essentially taking it easy, which involves not doing any strenuous activity and just maybe limiting yourself to computer work or answering phone calls. Normally, patients follow up with me anywhere from post-op day 5 to 7. And at that follow-up visit, your splint that is on your nose will come off. And then I normally have 5 small sutures that are here under the nose, and those come out. At that point in time, I normally will put tape back on the nose, and then I'll also suction out somebody's nose because they will have had their septum done. And so you have to get some of that swelling out. In my practice, I normally do not use splints, so normally there's nothing, quote, coming out. The material that's in your nose in my practice is absorbable and dissolvable. Now, from post-op day 7 to 14, same routine, just kind of taking it easy. And then normally I see you back on post-op day 14 to make sure you're doing well, make sure you have any questions. And usually at that 14-day post-op period, you can get back to resuming your normal activities. The next follow-up point will be 2 weeks later, your 1-month follow-up. And at that point in time is just your 2-week follow-up, be answering any questions, making sure everything's healing up well. And by that 1-month follow-up, you should be breathing quite better if you've had your septum addressed. Now, the next interval is normally going to be at 2 months later for your 3-month follow-up. And it's the same thing, just make sure you're healing up well, you're breathing well. And then normally I have my patients follow up at 3-month intervals. If you've done any reading on rhinoplasty, you will see that normally a rhinoplasty takes about 9 to 12 months to fully settle out. So what should I avoid during septorhinoplasty recovery? When you're recovering from your septorhinoplasty, the things to avoid is going to be essentially not doing too much vigorous activity. The dilemma with that is everybody has in their mind the things that are, quote, vigorous. What I usually tell patients is to keep it simple. Keep your activities limited to doing computer work, if you work at home, answering phone calls. I certainly recommend patients not to be doing any heavy lifting, any strenuous activity. Avoid bending over, no nose blowing. If you happen to sneeze, try to sneeze your mouth open. Really just trying to prevent increasing pressure to the head and neck area during that recovery process. So how do you maintain septorhinoplasty results and getting the best result possible? I can't stress this enough to my patients is follow our recommendations. And if we're not doing your procedure, obviously follow your surgeon's recommendations. And those recommendations should be essentially taking it easy to give your nose time to heal. The other things to do are to make sure you follow up with your surgeon as they advise on their protocol, and then taking care of the incision itself normally requires doing things simple such as applying a very small amount of sunscreen on a continual basis. And then if you so desire, you can certainly apply some vitamin E oil to the incision area. So during your recovery process, how do you know if you should call your doctor? What I usually tell patients is that if you're experiencing any increased discomfort, and what that means is every day should get better from the day of your surgery. If things change and things become more sore, if you start to notice redness, certainly any fevers, chills, anything where you're not continuing to improve, I would certainly call your doctor immediately.